booth demo right now at the Medtronic booth. We'd like to welcome Dr. Adam Caballo from Medford, Oregon, and he's going to kind of talk through his journey with Synergy OLIF 360.
Welcome everybody. If we'd have maybe some of the surgeons come forward so we can kind of show you this demonstration here. If you're interested in seeing the navigated 360 workflow. So what we're going to talk about is essentially one of the most exciting and one of the most innovative things at NASS this year. And what it is navigated OLIF 360. It's the ability to place interbody cages from an oblique approach, as well as posterior pedicle screw fixation under computer navigation. Now to tell you a little bit about myself, I'm living in Southern Oregon, Medford. I've been in practice since about 2011. My former chief in residency is right here, Dr. Andy Cranenberg, and he's also my partner. So we live in an area where it's kind of a small community. We see mostly degenerative cervical and lumbar spine. So my practice consists mostly of degenerative type fusion cases. Now in fellowship, we did a lot of ALIFs for interbody work. And my attending, Paul Slozer, is actually at the Titan booth right now giving a talk. So once we got out of practice, I didn't have access to an access surgeon readily. And so I wasn't able to do as many ALIFs. So I started to do more laterals, X-lifts, as well as T-lifts. Now in terms of T-lifts, it's a great procedure, but I had difficulty because it was working through a small working area. I occasionally had patients wake up with temporary leg pain. Sometimes you create a flat back. And there are some surgeons out there who are great at T-lifts, but I just wasn't very facile at it. In terms of laterals, I had great clinical results doing X-lifts and laterals, but there are occasionally times when the monitoring was clean, the case went well, but the patient still woke up with a femoral nerve palsy. And that's a difficult experience, for a surgeon to have to go through that as well as their patient waiting for that nerve to recover. So I thought there must be a better way. And so that's where oblique lateral interbody fusion came into play. Approaching the spine from an oblique trajectory and being able to place the same cage you would as an X-lift or lateral. Now it's not a new procedure, it's been around for a long time, and the beauty of the procedure is we're using the patient's natural anatomy, the psoas muscle, to buffer the lumbar plexus and femoral nerve. And people talk about anti-psoas, in front of the psoas, anterior to the psoas. It's kind of a misnomer. Essentially what we're doing is we're trying to avoid the neural elements, the lumbar plexus and the femoral nerve. And that's what we're accomplishing with OLIF. And so when I started doing OLIF, I definitely had a lot better results in terms of neurologic complications. And things were going great, but as many of us do as spine surgeons, we try to innovate and improve. And that's where Medtronic's stealth navigation and O-arm came into play. In addition to the OLIF procedure, we have now integrated performing single position surgery, meaning we're able to place pedicle screw fixation from a lateral position as well as the interbody cage in the same setting. And so we have a demonstration here with the navigation screen up front. This is our model here of the spine and patient's anterior, patient's posterior on the right side of me. So this is our retractor system we have docked, and we're able to take our navigated instruments, do the disc prep under navigation, including disc preparation, trialing, and final interbody placement. And at the same time, we can navigate to the back of the patient while the patient is still in a lateral position, place bilateral percutaneous pedicle screw fixation in the same placement you would as if the patient was supine, and accomplish all of that in a single position. And you can imagine being able to keep the patient in a lateral position saves an extraordinary amount of time and improves the efficiency of your case. And there's no downside and there's no kind of compromise to your traditional surgery of flipping the patient to a supine position. And so that's kind of the beauty of the case, is being able to navigate the entire case and keep the patient in a lateral position. And this has greatly improved my practice in terms of efficiency for the OR and for my patient outcomes. And one of the other things we're looking at, and you can see the demonstrations on the side, we have the Mazor robot. And so looking to the future, we're now looking at OLIF 360 in a single position with simultaneous robotic assisted procedures. And that's kind of one of the first steps in innovation for Medtronic, and we're looking into the future of developing more advancements in spine. And this, for me, has had immense effect on my practice and for my patients. Now, if anyone has any questions, feel free to ask, and we have the demonstration with all the navigated instruments for our OLIF 360 workflow, and there's a number of different things we can show you. Thanks for everybody for coming.